from our summer pause. Hi, Susan. I see Corey, I see Christian, I see a good bit of folks here. So we'll go ahead and get started. So as you folks know, I am Joni Nelson, your Rural NRT facilitator for the Oral Health Progress and Equity Network. We've done a good bit of awesome things around rural oral health and discussing how we contribute to all of the things related to the open network, how we've collaborated in areas of influence that we have specifically related to rural oral health equity. So I want to welcome us all back again from this summer pause and just remind us, these are points that we always just try to make since the last time that we've met. We had some priority goals, so we'll talk about those and then talk about some action items, specifically those roundtable themes and how we've been trying to turn them into some disseminating pieces. It's been a little bit on the slower roll, but we've got some good traction now. And so we want to go ahead and strike while the iron is hot. So before we get started with our specific action items, I would like to welcome us all back with a who's on the call and a kind of breaking into our time together. So our question this time for our meeting is, if you could have one superpower, what would that be? And I am going to put Zil on the spot and ask him to start us off with this question. And then Zil, whom you are and how you are contributing to the conversation and the organization that you are representing.
Not to put me on the spot or anything, I see how it goes.
You see that, Zil? It's tit for tat. We love you, Zil.
I understand. Hi, everybody. My name is Zil Joyce Dixon Romero, and I'm with the National Rural Health Association, and previously served as our manager of program services, but now have transferred over to our government affairs division and as our state government affairs manager moving forward. So I'll use that as a springboard of what I wish my superpower could be, to expand Medicaid in every state. That was the superpower I wish I could have. That or flying, it seems both would be beneficial to me. Pleasure to see everybody. Happy to see you all. And I'm going to turn it over to Piper Martin, who is also with NRHA.
Hi, I'm Piper. I just started with the program services team at the National Rural Health Association, so I'm very excited to be here. My superpower is a hard question. I would love to have time travel, but we'll see.
Awesome. Sue, go for it.
I'm Sue Keller. I'm in Deerfield, Massachusetts. I'm the Massachusetts grassroots rep for Open. And if I had a superpower, it would be flying, because last year I jumped out of an airplane. It was pretty darn cool. So I think I'd like to just be able to always get where I need to go without the traffic.
Who's next, Sue?
Raise your hand if you haven't gone. Corey.
Hi, everyone. I'm Corey Jacobson. I am with Delta Dental South Dakota Foundation, and I am also the South Dakota State Representative. If I could have any superpower, I would want to be able to read people's minds. No more guessing as to what's going on in a room.
Nicole.
Hello, everybody. My name is Nicole Payong. I am the Policy and Advocacy Coordinator with the Pennsylvania Coalition for Oral Health. And if I had to choose a superpower, I think I would choose telekinesis. Sometimes there's just a lot going on, and I'd like to be able to move things a lot quicker than having to wait for somebody with more superhuman strength than I have. So I think Dr. Kimball, did you go yet?
No.
All right, I'll go ahead and tag you in.
Okay, Nicole. Eve Kimball, a retired pediatrician. I'm working with the American Academy of Pediatrics Pennsylvania chapter. We're working on trying to find out where people go on social media and the web to find out their information and what they look for when they're thinking about their teeth, so that we could put good information and sources to good information there, because doctors and dentists don't see people for very much of their life. And if I had a superpower, I'm a little leery about superpowers, because that means I don't have to deal with anything else. And sometimes the complicated stuff is where the real meat of what getting things done is. But if I had a superpower, I guess it would be to help me find where all those people go and what words they want, because we're having troubles with that. Oh, call on somebody. Christian.
There we go.
Good morning, Christian Muller Anderson. Thank you so much. I serve as the executive director for A Smile for Kids. We fund orthodontic treatment in all 36 of Oregon's counties, and we are now a new partner in managing the brand new orthodontic Medicaid benefit in the state of Oregon. So we serve two different purposes. I am also state rep for Oregon and lever lead. So that's all about me. But my superpower, I'm not trying to sound like Mother Teresa, but I think my superpower would be to heal trauma. And I will call on Gary Turco.
Thank you, Christian. Hello, everybody. I'm Gary Turco from the Connecticut Oral Health Initiative, nonprofit statewide here in Connecticut, trying to improve the oral health care system for all. I do community engagement. Been with the organization for about 2 years now, and I will admit, most of my community engagement has been in urban areas. Just a lot easier to reach people there, a lot more events. So I'm trying to expand into the rural area. I know there's, different obstacles for accessing care in the rural versus urban and suburban. So I'm excited to be part of this group, learn a lot about what you're all doing so I can see what we can replicate here. As far as superpowers, I don't know if anyone else said this, but making time to stop. I never can seem to get everything done that I need to. And I look up and the 4 hours have gone by and it's time for another meeting or to go somewhere. And I didn't get everything I needed to do for the day. So if I can make time stop, I would accomplish so much more. Thanks, everybody. Happy to be here. Oh, and let's see who has not gone yet. Francis Walsh, I don't think you went yet, right?
Nope. Hey there.
All right.
I'm Francis. I am part of the Open Network support team, supporting this movement from as many angles as possible. I love this question and I love a lot of your responses, particularly the altruistic ones. But my first thought was, if you all saw the movie Jumper, you know how you can just like pop from location to location. I've never seen a movie where I actually tried to have that like I tried hard for days. Just like, I know I have it in me. I'm gonna make it happen. I never did, but I really think that'd be cool.
That's my favorite movie, Francis, with Hayden. Yeah.
Sweet. I think we have
There's a few numbers on the call, or if there's anyone else that hasn't shared who they are, their organization, and tapping in on our superpower here. I'm not sure who has not gone yet. There's a couple of numbers there though.
Hi, I can go. I'm on my cell phone. My name's Dana Schaefer. I am a dental care manager with UPMC for U Health Plan. and I had trouble joining, so I didn't hear the question. So what is the question to answer?
The question is, and welcome, Dana. The question is, if you could have one superpower, what would it be?
Oh, probably telepathy, I guess. Just to kind of know what's going to happen or what's going on, especially when it comes to the grandkids.
Anyone else that we missed? Thank you, Dana.
I am Brittany Smelser. I'm with Interfaith Dental in Tennessee. I'm a grassroots rep, and if I had a superpower, it would be time travel. I think that would be fun.
All right. Anyone else? If not, I've already introduced myself. Thank you guys for letting me facilitate this time. And I would have to say being in two places at once, or maybe three or four. I think that might be a little unfeasible, but sometimes I think we've all been there where it's, man, I want to do these things and be present in a lot of different places. So thank you all for entertaining me and whom we have here today. You can tell that there's a variety and a diverse group of folks that join this call, for those of you who are new and those who are returning. And I think our conversation today is going to need that. So wrapping around our purpose, I know y'all are sick of seeing this, but I have to do it because it reminds us, it frames us, and it helps us to narrow in on what this response team does. And that is to specifically engage open members in oral health policy, education, and research with a rural focus. So we have 3 specific targets that we prioritize, and that's identifying policy advocacy opportunities. And there's a lot of good work that happens with the policy NRT. There's developing and highlighting strategies to engage open members around oral health issues, specifically for rural communities. We've seen that happen a lot and expand into workshops, seminars, national conferences, other types of initiatives and public health research efforts as it relates to rural community impact. And then the last, promoting data collection efforts that examine oral health in rural populations. And we've seen that occur at a lot of different collaborations. Specifically, there's one highlight of More Care, which is a rural oral health initiative that prioritizes interprofessional oral health collaboration. And that's just one example. There's so many others that the National Rural Health Association has highlighted in their compendium of oral health best practices. They've updated that over the years. And we've also seen things come out of HRSA from some folks that are represented on the little squares today that you see on our Zoom call. So that's our purpose. We definitely have good connection here with Open, but rural oral health expands into all of our various different organizations, our communities, and our states. So I wanted to make sure that we knew that that's our purpose here. We do have specific activities to address our purpose and our goals. Those have been set forth here. This is a recapture of what we discussed in spring 2023. And those activities to meet those goals were to specifically integrate with other open NRTs and specify key partners to ensure representation. So we have done that previously with some of the work that we've done with the policy NRT, as well as AIDPH and their work with Rural Echoes, the work that we've collaborated with NRHA, and a few others where we've done some small webinar sessions through Open and some through CareQuest. So we've had some good traction with that first point. The second was creating a document that shares rural oral health wins that open, specifically open members. So our state reps, our ROCT members, our lever leads, oops, and we need to make sure we go back, our lever leads and so forth. So we've created that document in the past and have been updating that. I think the more that we hear from you guys as far as rural oral health specific wins, that has always been helpful. It's given other states ideas about things that they can advance in their own states or ways that they may need to modify and or approach differently. Specifically hearing from a lot of the oral health coalitions and some of the work that they've been doing. So that's been a pretty good opportunity to share those. That's on a rolling basis. So we hear from you guys when we meet at these meetings, but we also in the past have taken polls and requests. Francis has sent out things related to anything, any new updates that have been going on. And some of those wins look like, hey, our oral health state plan now has a specific focus on rural oral health equity. And that's just a really big example that's happened in a few states. The third activity is this concept that we had to potentially partner with the National Conference of State Legislatures to craft an open rural oral health one-pager and share highlights from the virtual roundtable sessions. That is something specific that we will talk about today. The fourth is like number 3, finalizing this rural oral health in a post-pandemic society white paper based on those roundtable sessions. So both 3 and 4 are potentials. It is not a direct map on that it will be routed off to NCSL or, specific places, but those were some of the ideas that we had in the past, given our opportunity to participate in a webinar last fall, specifically talking about rural oral health. So these are just quick reminders of what this group discussed in the spring and how we hope to move forward and advance these activities. Specifically, we're going to have some breakout session time to talk about 3 and 4. So Francis has sent out a few times over this summer and more recently this document that has our roundtable session from last fall that focused on 3 different areas, specifically all related to rural oral health. There was a prioritization for interprofessional oral health, community-based efforts around oral health, and then the last, innovations in rural oral health. So these were the initial kind of impressions and call outs from that document that has been disseminated for feedback. And one, the authorization of teledentistry, improving access to care for rural communities. Number 2, this idea around how to master team-based oral health care. So there's really good examples that we have seen. Pennsylvania, Colorado, South Carolina, they're all managed differently. Oral health is definitely managed differently in all those states. Even North Carolina and South Carolina are vastly different. And so all of these states, they just have some really good highlights of what they have done to integrate dental preventative care, risk assessments, and opportunities for this interprofessional case management for patients in rural areas. So that was just an initial roundtable call out that was really glaring. The third being having success in community-based approaches are not unique to underserved areas, but it does account for access issues as well as other opportunities to reduce oral health disparities in rural communities. And some of the examples that came out of the roundtable specifically were school-based oral health programs, Head Start programs, and other public service types of programs seem to have really good outcomes. And the last kind of initial just theme that came out was the potential of teledentistry. The pandemic has demonstrated a lot of different things in a wide variety of states. And there has been an opportunity to kind of test this theory as it relates to the utilization of teleconsults for dentistry, triaging serious need for access to oral health care, and then the opportunity for dental providers to bill for those services. So while addressing concerns of quality of life, care, and patient safety, there's been this kind of open box to this utilization of teledentistry that we have seen amid COVID. So that was kind of a different theme that we've seen there. None of these initial roundtable call outs by themselves may be things that surprise you. But together, coupled with this post-pandemic, if you will, thought process, it may mean something more than what we think. And so these roundtables, codifying them in some sort of brief 2 to 3 pager can be really important as a point of departure and or as a point of information for advocacy, as well as advancing the significance of rural oral health. So these were just some of the initial roundtable call outs, just to refresh your memory, because I know all of you read it. And we thought that it could be a good idea to go into some brief breakouts during our time today. So maybe about 10 minutes or so, 10 or 12 minutes or so. You are not bound to these questions, you guys, but the main thing is to be able to talk amongst one another about what did you see, what stood out to you. I threw out, those initial call outs. What areas need to be emphasized? So at this point, we can't go back and change things. The round table was what it was, but we can say, I think we should emphasize this because of this new policy that has recently come out. Or in our state, this has been a point of significance because we had these new changes as it relates to billing purposes. And then number 3, just what lessons can be taken away. And one of the biggest things I think that we had discussed in the past is it's not that we have the same innovations or the same things that we're working on. It's that we have the same consistent problems. So with that being said, how are the things that we saw in these roundtable sessions, how can they continue to be advanced and put forth as real interventions and or real exercising of policy and or real opportunities for training and clinical workforce development? So that is the charge for these breakout discussions. So Francis, not me, because if it was me, we would all just be in here talking. All the breakout stuff, won't even be able to do it. So Francis is going to codify us into smaller groups, and this will be the opportunity for you to utilize these questions to guide your conversation on initial impressions about what was written up for the roundtable session. So Francis, I will turn it over to you.
I'm also making breakout rooms, and I'm not sure what to do with these Meat Geek note takers. So I think I'm gonna put them in rooms if that's.
The note taker is mine, so we can put it in my room.
Okay, there's 4 of them.
Oh,
One of them is mine too. This is Annalise.
Okay.
It doesn't matter where you put it, just you can ignore it. It's just so that I can figure out things later if something's been assigned to me.
Totally. I mean, they're a lifesaver too, as a note taker myself. Okay. So am I just teeing up the breakouts? I'm sorry, I was
Yes, you are.
Okay, perfect. So I dropped the questions into the chat, so you all should have those. It looks like there are 4 or 5 per room. So if you all could figure out who will be taking notes and then be ready to just share back the key whatever conversations. Also, I do see a number of notes from some of you in the document itself, and thank you so much for providing those comments. So I'll take both those and then the discussion from today, everything that you guys come up with, and we'll start to work that into a final document following this. So before I open the rooms, do we have any questions or all set, ready to go? Perfect. And we'll see you back, Joni, you said about 10 minutes?
Yes, please.
See you all soon.
Thanks, Francis.
Yeah.
Rural areas that we could come up with a whole different way of serving, kind of like a MASH unit, a mobile MASH unit. I call it a MOSH unit because it'd be like mobile oral health surgical hospital. And you could have, it could be tent based, but it really could just go into a building and just have the new graduates, that's actually a career for them. They actually get paid to go and spend time in different places. It might be 1 week here or 3 months there or whatever, but it's actually part of a program and they all do it together. And that would be a new career path besides just corporate dentistry, clinical practice, or go to a residency. And if they were supported by older doctors who had a lot of skills, somebody was just talking about it was Zill, I think, about there not being enough specialists and things. So if the retired specialists want to like tag along as part of this program, you got a lot of skill there that can help train the young folks and have those two opposite ends of things, you know, really just get out there and get the work done, which also has to tie in with what Eve was talking about with its prevention. You got to do, it's a both and. You got to do the care that needs to be done imminently, and you also need to do the prevention so that you don't need less care in the next generations.
Thank you so much, Sue. So I'm going to, Francis, how many rooms? 2 or 3?
So initially it was 3 and then
Okay.
3 came and then requested to be broken apart. So,
Okay. So I am going to ask for the spokesperson or the note taker of each of those groups. If you could give us a 30-second, just kind of what kind of came out of your breakout session, and if you wrote any bullet point things down, which I'm sure you all did, if you could email those to Francis so that we capture all of it. So I'm going to start with group 1. I don't know if they were labeled like that, but group 1, whoever that spokesperson was, if you could give us a little 30-second snapshot of what came out of your group.
We were 1, and I think Sue did a pretty good job summarizing what was kind of that ending point where we were at, unless she's got other things to add on there.
I want to add on something that Zill had brought up is one of the, and also Eve talked about the problem that we don't do enough with prevention and helping people be their own, you know, to take care of themselves on a personal level, not just from all the systemic issues that we could do so much more with prevention. And then Zill pointed out it's hard to get past legislators because they're always saying, well, where's the data? Where's the data? And the clinician in me said, so tired of getting data, just go out and do what needs to be done. We need to get people out there, and it has to be a combination of people, but also there's so much education that can be done using teledentistry or using the internet, or just having things, there's ways to contact people that don't involve necessarily as much one-on-one. And yet there's some things that we need providers out in the field to do. And it's getting a little bit boring to hear that we've had the same problem for 30 years and we haven't figured out a solution to it. So there's a little frustration around that.
Thank you, Sue. And I also know that Francis has started recording this, and all of the things that we say will be captured there as well. And she's taking notes as well. But I just wanted to make sure we got a comprehensive pull of all of these points that you guys are making. So group 2, if I could ask you guys to do the same 30-second kind of share out there.
Well, I don't believe we had a formal note taker, so I apologize if I mischaracterized
That's okay,
anything that we
Nicole.
talked about.
That's all right.
But I think what really stood out as far as our key points was how consistent this messaging or these highlighted problems were compared to everywhere else that we're reading about rural health access issues and oral health care access issues. There was also just the importance of really punctuating the need for collaboration. we know it's important. And I think there's probably more of a positive in some rural areas where they already are practiced in how they make those partnerships work, as well as knowing who the community partners that they need to connect with are. And kind of an offshoot of that is when we look at medical and dental integration, how do we speed up the time from when we get, AAPD sending out the SDF guidance to where it's actually being implemented regularly, so we can get those preventative measures in place, as well as just getting that integration to happen quicker. As well as, what other innovative solutions can we come up with when loan repayment isn't enough to get providers in rural areas? So we looked at how do we support those communities with whether it's childcare needs or making sure there's livability for their spouse, great schools, things like that, that providers may be looking for.
Thank you so much, Nicole and Group 2. Very good call outs from both of the groups. And this is just a good opportunity to hear you guys verbally kind of respond to what was discussed at that roundtable. Pushing up on almost a year here. So we're wanting to make sure there are things that might have changed. So having those impressions of you guys' feedback is great. So as Francis mentioned, the points that you guys made today, there have been comments on the actual document, will be finalized into what we are hoping will be a formalized peer-reviewed white paper. And we have opportunities for some target journals that just logically make sense, that have an emphasis on rural healthcare services, access to care, and innovations in healthcare outcomes, which we all know oftentimes oral health is not gleaned as the priority, but given different changes in different states with expansion of Medicaid and different parts of Medicare, it will be very valuable for us to have something like this disseminated in a peer-reviewed format. The second piece, which was, I believe, number 3, was having an opportunity to take what you guys talked about and putting it into a one pager digitally. Again, this is kind of just a repeat, reinform here, that there could be an opportunity to disseminate this through the National Conference's state legislature, which would be really helpful as they adopt things that have been happening in reputable contributors to the field of oral health, such as Open and the affiliate organizations that we have partnered with. So as we create these 2 separate pieces, one that's more peer reviewed and the other that can be disseminated to places like NCSL, but it can also be used for your own organizations, again, as a point of departure at the current state that we are in for rural oral health. So I think this was a great just final, this is what we think about this document, these roundtables, and a way to kind of add some lipstick to what we already have. So I think if we are all okay moving forward with finalizing those documents, then I think that is what we will do. You guys entrusted Francis and I to pull together what we have now. So we'll kind of do that again and include these new comments that you guys have that have been on the Google Doc or that just got put on the Google Doc plus today's meeting. And then what you will see next is those finalized documents, those 2 different documents. So if all hearts and minds are clear with our next steps moving forward, then I think that's a good place to be for our group with those activities. So I'm hearing that all hearts and minds are clear. And I do not, because I see Sue. Sue, can you where did it go? Oh, here it is. So Sue, you said, what if we created think tanks to further brainstorm more innovations that could actually be new solutions for our recurring rural oral health access issues? What is being done currently is not enough, and we need to imagine the possibilities. Any first impressions on Sue? Or Sue, if you wanted to.
Well, just saying that one of
comment.
our action points, it's not going to be enough to just to go with the representations that we had from our roundtables. In other words, those are very specific things, but they're not going to overall solve anything. And we just keep hitting the same problems. And there are some solutions that were within the roundtables, which I think is going to be important to highlight. These are things that did work, but the problems are more comprehensive, and we keep trying. When I am attending some of these groups, Zoom groups, it's like people are looking for the same solution, and it's not going to work. It's not working. It hasn't worked in 30 years. So I don't think we've really had a chance to sit down and talk and really brainstorm and like play off of each other about how to make some different things work. And that always being innovative needs, and thinking about innovations needs to be part of the big plan. Not just, okay, the things that we need to do are out there already, let's just implement them. And yet there's some things that we know need to happen that aren't happening.
And I think your point of emphasizing the innovative solutions that came out of those roundtables hits the mark. We are one very specific smaller group, but there's some powerful examples there that did come out of those roundtables. And you were right. What we are doing could be advanced. I think because we have a very narrative or a very narrow specific content for oral health, it is rural oral health. And so there's parameters for what can be done, what has been done, and the like. And so I do think emphasizing the innovations that are working and advancing on those is going to be important. And whether that be, Sue, a think tank or something of the like, I guess I think about some of our other NRTs, like the policy NRT or the data NRT. I think some of the things that we have found or that emerge from those roundtables can definitely be shifted off, talked about, because there's just some strongholds on action-oriented things for policy as well as data, whereby they could use those innovations and solutions and catapult from there in collaboration with what they have received from us. So I spot on.
I want to jump in just with some of the thoughts you all shared. I think that like largely teledentistry was broadly discussed across all three of the roundtables. And I think more importantly, it's like the lessons learned from different states who've implemented and different ways of going about it. But like really, how is it that we can speed up like the integration, the innovation and kind of like, you know, the spreading and scaling of what is working? So I think what we really highlighted last year was like the different ways that, you know, these models are working and how innovations are able to shift the needle. And we know that we're improving access, we're able to be cutting costs. So I think, you know, demonstrating those actual outcomes for patients and being able to make these arguments for Congress with actual data. And I think that'll be the next step. And I'm hoping that with this work, with this white paper, kind of like, here are our lessons learned, here's how we can push this forward, and then actually utilizing you all, I think not only for think tanks, but also like, what is going on in the States? What data do you have around these programs? But yeah, there's a tremendous amount of opportunity here. So I'm pumped with these conversations.
So in true Joni fashion, as y'all know, Zil will tell you, and so will the others. I want to make sure we're on time, even in the midst of all of these rich things. I want to pause here to hear from you guys about any announcements or things that this group needs to know about. And Corey, I see you. Francis, can we just make sure CHWs is not lost in our language? in that document, which I think somebody might have said that before, but thank you, Corey. So
It's a number 4. It's there.
That's what I was like. I feel like that something should be there. And any announcements or any pointed statements about things that are going on that folks want to share?
Well, I was just
Pause
gonna,
here for that.
speaking of community health workers, NRHA is looking at doing a dental community health worker training in Southern Alabama later this year, hopefully. So just wanted to tag it onto the CHW ideas.
Perfect. And dovetailing on that, Zill. So Sue and Eve are talking about dental navigators and that concept. So there is community dental health coordinators, so CDHCs, which is a program that was designed and developed through ADA. They actually have a curriculum that is offered. It can be offered virtually. It is a very rigorous, dutiful training. And it can be offered. I think they have multiple cohorts going at a time, but it's virtual. All of the courses are virtual. They have some in-person stuff based on where you are in the state. You receive it is a training hours. You actually have a research project. There is a community-based portion, and there are other required sections. Mostly our community dental health coordinators are hygienists. Some are dental assistants that are going into dental hygiene to receive their certification and training. So there is a program that does exist that has done well in a lot of different states. And so it's not that the CHWs have not been utilized in certain settings, especially FQHCs, but the community dental health coordinators is a recognized training that has been pretty, I think it's a pretty good program, and I'm still learning about it, but it has been useful. So I did want to make that point there.
If I could just interject real quick, in South
Sure.
Dakota, we just started a real big community health lift, a community health worker lift. And there is ourselves, Delta Dental South Dakota Foundation, as well as a private dental office and FQHCs, and a pediatric dental office that are training their own community health workers. And they're not even having to be dental staff. They are people from the community. And so they are going through the community health worker program, but sticking into the oral health realm. And so it's really trying to help that whole situation. We're stumbling through billing because you have to, dental Medicaid here cannot be billed for the service. So it has to be through medical. And if you're not used to billing medical for surgical procedures, then learning Medicaid billing for the medical portion is its own nightmare. But anyway, we do have a process that we're trying to do right now. And in our last call, if we get our claims going, we will be the first state to submit a dental CHW claim.
Yay! Corey, I am putting you on the spot. So Annalise does these rural echo sessions. And Annalise, I don't know if this fits here, but that would be a great case study to talk about. Corey, that seems very intriguing, all the way from how you guys started this, the vision and the motivation behind it, but that would probably be something that a lot of states and a lot of advocates would want to hear about, as appropriate as it is for you to share certain details. But that could be a great case study to hear different things about what your state has done to codify that and execute. So Francis, I think we're at a good place for you to update us on next call things, all open things, and the like.
Awesome. So I had shared a lot of updates on open communities the other day, and I put that all into a PDF and tossed that in the chat. So you have at a glance all the things open upcoming. As you all know, Virtual Hill Day, that's September 12th and 13th. We have the national meeting that will be October 24th through the 26th. And that CVEN update or save the date, that should be sent out next week. So hopefully you'll all have all that information right there in your calendars. So the next call that we have together is October the 19th. And same day, same time, that's 12 to 1 Eastern. And am I missing anything that is open and upcoming? No, we do. And we do have all of the virtual Hill Day webinars that are coming up. We'll be starting with the Heads Up Act next week on Monday. So if you're involved in Hill Day, those will be recorded if you can't make it live, but let me know if you need any of that information. It is on Open Communities, if anything. So check that out. And I think with that, it was so lovely to see you all hear these conversations. And thank you so much to Joni, who is a rock star holding us all together.
Thank you.
Thank you all. We will see you all next time and be in communication.
Thanks,
great
everyone.
week.
Thank you,
Bye.
Jenny. Bye.
Hi, everybody.